Hey everyone, and welcome back. I'm Mike Wade. Thank you for tuning in to Dissect and Connect, a podcast where we explore population health issues impacting your community. This podcast is a service of Montgomery County Prevention Partners and New River Valley Community Services. Our podcast is made possible by a grant from Carilion Clinic. The views expressed in this program may not reflect those of Carilion Clinic. Andi Golusky is Executive Director of NRV CARES, a position that she's been in for a little over a year now. Prior to taking on her new position, Andi actually worked at New River Valley Community Services for about 10 and a half years, where she worked in intensive services for children and families. At NRV CARES, Andi is working to help prevent trauma while strengthening families and protecting children. Andi attended Virginia Tech with undergraduate degrees in psychology and sociology, and fell in love with the NRV, so she just never left. Andi's also a licensed clinical social worker and an adjunct faculty member in the School of Social Work graduate program at Radford University. Andi and her husband Mike currently live in Christiansburg, and they have 2 young daughters. So Andi, welcome to the Dissect and Connect podcast. Thank you so much for taking time to join us today.
Thank you so much for having me.
Yeah, excited to have you. Let's start off by just getting you to share an overview of NRV CARES and what your organization is responsible for.
Sure. NRV CARES, we're a private nonprofit agency, and we are dedicated to strengthening families and protecting children with a vision of our NRV free of child abuse. And so we are specifically, we focus on child abuse prevention. And we look at the 3 different types of prevention that there is: primary, secondary, and tertiary, and our programs touch on each of them. We have 3 specific program areas that we focus on: parent education, community education, and then we also house the CASA of the New River Valley program, so the Court-Appointed Special Advocates program. With those combined, we're hitting all 3 levels of prevention, and so feel we're really well-rounded in providing those services to the community. And we also are NRV-wide, so we provide them to everyone in the NRV.
Okay, great. So, like everybody else, I'm sure that NRV CARES has had to adapt some of what you're doing in the face of the COVID-19 situation. Can you talk a little bit about that and what you've been doing to change how you're approaching things?
Absolutely. One of the biggest things that we provide is parenting young children courses, and we focus on the 0 to 6 age group, and those courses are 8 weeks in length. They're evidence-based. We have childcare provided, we have dinner provided, and it's really a time for parents to learn, but also be together and have that working to build kind of a network within them. And unfortunately, because of COVID-19, obviously social distancing prevents us from doing that. Even prior to kind of the social distancing orders, we were holding these in churches. We really need the community support in providing us facilities to hold these classes. And so a lot of those churches were not going to be able to let us in, understandably, of course. So all of our programming for the rest of the year has been called off or, postponed for now. And, it's really unfortunate because we know a lot of these parents need this help and need this support and education. And so, that's absolutely one thing that's been affected. The CASA program has been also very affected because our folks can't necessarily go see the kids in the homes and in the placements they're at. They can't visit the parents because we also want to keep them healthy and safe. And so we're really trying to utilize phone calls, things of that nature, for them to stay connected with their cases without having, breaking that social distancing, physical distancing issue. And of course, our community education classes are also on pause because of the fact that we can't, those were also held in churches. They were also to a wide audience.
Right.
So, when you're in the human services field, as you know, Mike, a lot of what we do is in person. And so because of that, a vast majority of what we do has been changed, and we're adapting.
Yeah. And as a relatively small nonprofit, you also rely heavily on fundraising, and your biggest event of the year happened to fall right in the the midst of all this coming to a head and really kind of impacting what we do. So talk about that and how you adjusted to that.
Yeah, that was extremely challenging. Our gala it was our 20th anniversary too at that. And so for 19 years, we were successfully able to hold this gala without any issues in March. So surprisingly, no weather problems in the past. But a global pandemic will change things for you. Fortunately, we had, as part of our gala, we had mobile bidding and an auction as part of that. And so we kind of adapted and said, okay, we can't have the physical event, but what about keeping this auction? Because we had so much support from our community members and volunteers who, sought donations for us, a ton of local merchants and artisans and everyone donating to us. And so, we felt that, we could maybe get a good audience for that. And so fortunately, we opened it to the public. We made the event a virtual auction. And I actually became pretty successful considering, we couldn't have the actual physical event.
Right.
So it ended up being the third best event we've had in
that's
20
great.
years. So, yeah, so definitely was a little bit of a sigh of relief. I have a phenomenal team that was able to kind of adjust accordingly and make it happen. Now, of course, with any kind of fundraising thing, you look at, well, would this be the same circumstance if we weren't in the situation? And likely not. We love that physical event. It's a good time to get together. It's a really good time to also express our cause and bring people some awareness and understanding of what we do. And so that factor, unfortunately, wasn't able to, happen with the virtual auction as much. I think people who knew us were really helpful in spreading word, but, as far as reaching people, really getting what we do, that was a part missing that, it kind of is what it is.
Right. Well, I'm glad it went well.
Well, thank you. Yeah. Definitely, as a nonprofit in these times, it's extremely challenging. So, any bit of success is happy times for us.
Yeah. Every little bit helps, as they say.
Absolutely.
Well, hey, we are doing this interview in the month of April, which is also Child Abuse Prevention Month, and I know that historically has been a huge awareness campaign that NRV CARES has kind of taken the lead on in our region. So just wanted to see if maybe you could talk a little bit about that and maybe what you're trying to do this year in light of the COVID-19 situation.
Absolutely. Typically, we have a fundraiser in conjunction with Child Abuse Prevention Month, which is our Pinwheels for Prevention. And the Pinwheel has been adopted as a sign of child abuse prevention to show happy childhood, reminding us all that every child is deserving of a happy childhood. And so, we're very big about the Pinwheel. We love the Pinwheel. And so, unfortunately, because of the situation, we've had to kind of cancel our Pinwheels for Prevention campaign. We were able to sell a few before everything happened. So we'll have a few out. But typically, the idea is we really want to, have that awareness campaign. So we sell outdoor pinwheel gardens. We sell indoor pinwheel gardens with the hope of spreading them around the community. And because of the social distancing and things like that, we've had to halt that. However, we're going to use our social media platform. So we're pretty big on Facebook to kind of get as much awareness as we can as far as articles, really pushing the pinwheels and what families can do in their homes to help also spread this awareness. And so tomorrow is Wear Blue Day. So we will have some stuff regarding that and really, encouraging families and caregivers to wear blue with their homebound crew, wear it at home and post, and tag us in it because we really just want to spread that in the NRV. So, we absolutely don't want, as much as COVID-19 has taken over everything, and understandably so, children are still our number one priority, and protecting them is our number one priority. And so we definitely don't want it to be lost, especially, that these are stressful times for everyone. And as we know, with stressors, increases potentiality for things to happen. And so we really do want to maintain the focus on the month as much as possible, even though we can't have the physical events. We had a lot of fun things planned. Today was actually supposed to be the Save Jane campaign in Roanoke that we were going to be a part of that, obviously didn't happen. We were going to have a Happy Childhood Festival later in the month and things like that. So really unfortunate that those things didn't happen, but I think, we can do things virtually, and I'm hopeful that families can do things at home with their own kids and really just, embracing, providing their own children with happy childhoods, but the fact that every child is deserving of a happy childhood.
Right, right. So obviously, an agency like NRV CARES wouldn't be necessary if child abuse and neglect weren't an issue, but we know that sadly that is the case. And you and I have talked a little bit about data. Do you have some data that you could share? Some local data?
Absolutely. We have figures from last year, and these are from the Virginia Child Protective Services. And so from last fiscal year, so July 1st of 2018 to June 30th of 2019, the founded cases in Montgomery County were 206. NRV-wide total was 607 founded cases. In our world, one case is too many.
Right.
And so those numbers, are not what we want to see by any means. And our fear, of course, with COVID-19 is that this will increase. And that's where, again, we really do want to maintain the awareness and the light on Child Abuse Prevention Month, because these figures are startling. And I think statistics are hard, or numbers are hard, because I also think we have very diligent, Department of Social Services agencies who are really seeking to just help get all of our children protected and
Right.
get what they need. And so, I think rates can be, oh gosh, that's a high number, but it also, I think, isn't necessarily reflective. I think it's reflective also of the diligence of a lot of our, workers and social workers and stuff.
You kind of hinted at this, and I wanted to maybe follow up on it. The likelihood of increases during the COVID-19 situation, as we're all under the stay-at-home order. Can you talk about why that might be the case, and what we can do in our own homes to prevent and minimize those things from happening?
Yeah, absolutely. What we know about child abuse and neglect cases and rates is that, stressors, especially financial stressors, are a huge predictor. And, that's what a ton of people across the U.S. are experiencing right now, and across our state and our region, our area, is that people are potentially laid off. They're having to end jobs to attend to childcare. And then parents who are not used to having, being stay-at-home parents are put in a different role. And then also potentially juggling working at home. So you've got a whole lot of stressors that are going on for people, and a ton of change. And I think with those factors, that increases how people are kind of letting that out, unfortunately. And that could be on our children. And so when those, stressors mount, unfortunately, adults may use other outlets that are in positive discipline on children, and physical force, things like that, we just really never want to see on kids with children. And so I think ways that, parents can work through this and try to keep any of that from happening in their own homes is, we talk about social distancing, but I think it's physical distancing. So I still encourage parents to seek out supports with each other, having those phone calls, having those vent sessions, things like that. And so still seeking out that network, we can't see each other in person, but we still have each other. And so really utilizing that, taking breaks, really being okay with the fact that, technology time is going to increase. And as much as, I shouldn't be the one saying this, it is, because we all need to take a deep breath. And so encouraging parents to also be gentle with themselves. Because the other factor that I miss talking about is that not only are we providing childcare, a lot of parents are providing childcare for their kids, they're also having to provide education for their kids, and making sure that they're hitting all those education things. And so I think, that can be really daunting on parents who have not put in that role before. And, we want to do what's best for our children, and we don't want them to fall behind. So again, that's just another stressor. And so I think seeking out the supports of the teachers and the friendships and things like that I think can be really helpful for parents to get through this. Because that's the reality, is we do have to find a way to get through this together. And so some ways that we are adapting our programming is that, we have a Circle of Parents group. That's been pretty established, and obviously they can't meet in person. We're going to try a Zoom meeting tonight with them, and see how that goes, and so really looking at, was this helpful? Could this be something we open up to others, things like that. So we're really just trying, because this is all new territory for all of us, figuring out what might be best for our clients or residents and reaching as many folks as we can.
Yeah.
Because we also recognize that in our rural Virginia area that there's a lot of folks that may not have the technology and things like that. And so we hate missing them, but at the same time, we're doing the best we can with what we. And so we're really encouraging folks to follow us on Facebook and be in tune with those things, because we'll post a lot of helpful reminders and articles and things like that, as well as potential support that we have through our program.
Yeah, and I really like something that you said earlier, and I'll paraphrase that or rephrase it as I've heard it. It's really important, I think, for parents to give themselves some slack in all of this. You don't have to be Wonder Woman or Superman and Parent of the Year through all of this, because this is going to be a challenging time, and you're going to have to go easy on yourself. You can't have all the answers. Nobody has all the answers with all this going on. So I think it's important that you mentioned that.
Yeah, I feel it wholeheartedly. I think how we respond to our kids emotionally is really important now. And I think we may think education is the number one, but I think right now from a social worker's perspective, I think emotional meeting that emotionality for them and what they need there is really vital. And so but at the same time, like I said, being compassionate with yourself and recognizing that we are all affected by this. And and what I've kind of heard across the board from some working parents is that it's taking longer to do things, not only because we're in a different setting, but also because of just kind of the emotional fatigue we're all feeling. It's a lot that we're seeing and a lot of tough stuff. And so, as parents, especially, you're taking that on. As caregivers, you're taking that on even more so because of the kids. And so I think more than ever, finding those outlets for stress reduction, that, exercise, the walks, the calls, those just timeouts as much as you can, in this situation.
Yeah, some great advice. So, Andi, how can folks find out more about NRV CARES and get in touch with you all?
Yeah, our website is www.nrvcares.org, and then of course our Facebook is at NRV CARES. Like I said, we welcome everyone and anyone to follow us, and our hope is to just really gain awareness and support for everyone, because we are working so collaboratively with everyone in the NRV, and I think that that's what's awesome about our community is we all have our niches, but we all do work together. And so that's our goal, because I think ultimately we want to keep those adverse childhood experiences from being a thing, from keeping those levels as low as possible, because we know so much now. I think our kids now, we need to work to prevent them from having high ACE scores. Absolutely.
So thank you again for your time today. It's been great talking to you, and I think what you said was right on point, that we've all got to do our part. It really does take a village. I say that a lot, but I really think it applies now, maybe more than ever. So, Andi, thank you again.
Absolutely, and I couldn't agree more, Mike. I think we're all in this together, and especially even now. And so while we may see rates increase after this whole situation, I think it's how we respond as the adults and the caregivers and the teachers and the supports and the coaches to our kids, should that happen following this. And I think that that's something, again, it's not a happy thing we want to, leave in anyone's mind, but I think it's a necessary thing that we have to do to protect our, just having that awareness that, after this, there may be other things that we're going to have to rise to the occasion and deal with, and that we are all in this together. And as a community, we are, children are the heart of our community, and we all need to work to protect them.
Absolutely. Well said. And with that, I think we'll wrap it up. And I'll include links to your website and Facebook page in our show notes. So,
all right. Thanks, Mike. I appreciate you.
Thanks again. I'll talk to you soon.
All right. Sounds good.
Okay.
All right, bye.
Bye-bye. We hope you've enjoyed this episode of Dissect and Connect. For more information about Montgomery County Prevention Partners, our New River Valley Community Services, be sure to check us out on Facebook or visit nrvcs.org.